Hello there, welcome to One on One. My name is Bridget Otu. Today on One on One, we're talking about a subject that is dear to my heart. Dear to my heart because I come from a family of mom, dad, siblings, uncles who all have one eye problem or the other. I am one, and mine was even more terrifying because I almost got stroke out of it. Our eye is so important, yet there is very little known about what we can do to prevent it. But if you cannot prevent it and you have one disease or the other, whether cataract or glaucoma, remember we're even marking glaucoma week. So if you have cataract or glaucoma, what do you do? How do you go about treating it? Where is the help if you need one? And can it be prevented? And if you have it, can they treat it for you to be completely healed? These are questions that personally bugs me, and I'm sure there are tons of questions that you also have. And I happen to have an expert in that area. When we come back from the break, I'll introduce my guest, and he will tell us a lot more about, all the various types of eye diseases we have, especially glaucoma. And I'm particularly interested in cataract. What is the link between our eye, the brain, and stroke, and so much more? So stay with us. I know you're as curious as I am. When we come back from the break, I'll ask all your questions. Dr. Nashat Tarboush is an ophthalmologist with the Dr. Agrawal's Eye Hospital. And he's an expert who has over 10 years experience as an ophthalmologist, and he's done over 3,000 surgeries. He's Syrian but has been in Ghana and loves the country Ghana. I'll tell you why he loves the country Ghana. Beyond his profession, he also does charity work to help persons who don't have money to just go and get your eyes screened for free. Isn't that amazing? Doctor, welcome to my show.
Thank you, welcome.
I am always excited about conversations about the eye because it's so delicate. I always say that, look, you cannot get another eye. I mean, yes, you may get surgery, but you can't get the one that you were born with. So
for sure,
how you take care of it is very, very important. So I want to start off with basics. We're doing glaucoma week, so I want to start with glaucoma.
Yes.
It's the second leading cause of blindness in the world, next to cataract, correct?
Yes, but the difference between cataract and the glaucoma, mainly that the cataract is cause reversible blindness, but the glaucoma is irreversible. When you have glaucoma and the glaucoma is advanced or it affects the nerve, we cannot repair the nerve. But in glaucoma, we can prevent the damage to the nerve or decrease it as much as we can. In cataract, whenever you have cataract, mature or immature, beginning of cataract, or you have it for a long time, when we do the surgery, the blindness will be reversible, so you can see again. But with the glaucoma, the problem of the glaucoma, we call it the silent thief of the vision, because it's a
silent thief of the vision.
Yeah, it will start from the periphery and very slowly. It will take time until it attacks the central part of the vision. But when it attacks the central part of the vision, you may end having just something we call tube vision. The damage in the periphery we cannot reverse, we cannot treat. We can stop the damaging of the nerve by eye drops or surgery or laser, depending on the situation and depending on the kind of the glaucoma. Glaucoma here in Ghana is very famous. We can, between every 10 patients, maybe we have 4 patients with the glaucoma.
No way.
Yeah.
Well, that's like 40%.
Yeah, it's not in the population. It's in the patient that
are coming in. Oh, does that mean it could be higher?
Maybe higher, maybe lower. We don't have studies on the population to know how much the glaucoma common in Ghana. But for sure, it's very common. It's more than other places. In Africa, it's more than other places. The problem that the patient came to the clinic just for eye checkup or for another problem with the eye, like infection or inflammation. And when we check the nerve, we find sometimes mild, sometimes advanced glaucoma. And when we start to treat it by eye drops, the problem that these eye drops is like the blood pressure treatment. It's for lifetime. And patient take the medication, then they will stop it for some time, then take it again. That all will cause the problem to increase. And let us explain the glaucoma. It's a disease of optic nerve. The optic nerve is the part that take the signal from the eye to the brain so we can see. So when the eye pressure is high, that will increase dying of nerve fiber inside the eye and causing the glaucoma. The only thing that we can control in glaucoma is the eye pressure.
So what puts pressure on our eyes, or what triggers the pressure?
Okay, yeah. We will not talk about just the pressure. We'll talk about what's the cause of the glaucoma.
Okay.
There's first line, the genetics. It's a genetics disease, family disease. So please, when you have any one in the family has glaucoma, or you know about any member of the family with glaucoma, you have to check your eye once a year. Second, the age. After the age of 40, mainly 60, most of people are more, they are in a dangerous situation of developing glaucoma. The other thing is trauma. Sometimes trauma on the eye will cause glaucoma in the future. Other causes of glaucoma, diabetes can increase it. High blood pressure, and we know high blood pressure in Ghana is very common. And it's the disease, also we call the high blood pressure the silent killer. So it's connected to the eye pressure and the blood pressure. So after we find that the patient has glaucoma, we start the medication. This medication can lower the intraorbital pressure. The normal pressure inside the eye is between 10 and 21. But even we have some kind of glaucoma we call normal tension glaucoma, that the pressure will be normal
within the 10 and 21.
But still the patient has glaucoma. The treatment will be the same mostly, the eye drops first. If we find that one eye drop is not working, we add another eye drop, another kind of medication. We don't find it work, we may go to the laser or to the surgery. Sure. We also give the patient some vitamins to help improving the nerve fiber layer health and nutrition. Other than glaucoma, the second, you talk about cataract. Yeah. Cataract also is a reversible cause of blindness. The glaucoma is disease of the nerve, but the cataract is disease on the lens, in the eye lens. So when the eye, when we getting age, the lens will become more dense. That will block the light from going inside the eye. That's what causes cataract. That's the cataract.
Okay.
There's also different kind of cataracts. Age cataract is the most common. We have inflammatory cataract with some condition, inflammation inside the eye. Trauma cataract is very famous. A lot of diseases like diabetes, mainly hypertension, other systemic disease can cause cataract also. Also, there's some medication can cause cataract. We use some medication for back pain or the steroids, or that can cause some kind of cataract. Wow. Yeah. So, and the cataract, the good thing about cataract, the patient will notice it. So the patient will come and tell us that I have blurred vision. I cannot see very well.
Do you think that's what I have? Because I have that too.
Yeah.
I'm always like, there are times I have to squint really hard. So I squint for relief. If I don't squint, I'm in pain.
That's maybe a different problem. The cataract will, it's not on and off. you will have it
constantly.
Constantly. But
what
you are talking
about
is more something new disease called computer eye syndrome or digital eye syndrome. Previously, before some decades, we didn't use the phone and the computer for a long time.
I sleep with my phone.
Yes, so the vision, the near vision, we will not use it for a long time. We can read some books, we do some exercise or something for the near, but not for that long time with high light. And our works these days mainly on the phone and the computer. So the blue light coming from the computer will cause this problem. Also, the digital or the computer eye syndrome, it's a start like you said, discomfort in the eye. You not feel that your eye is relaxed. Normally, we blink between 15 to 20 times a minute. That's the normal eye.
Oh.
When we are looking at our computer or mobile phone, maybe we blink 4 times a minute. That will cause dryness of the eye.
Also, it's good to blink more.
Yes.
Ah, I didn't know that.
You don't force yourself to blink, but nowadays
so
we advise
would trigger that.
Because when we blink, the tears will spread on the surface of the eye.
Ooh.
That will prevent any irritation of the eye or any discomfort.
I had no idea.
Yeah, that's one of the problems that most of people don't know, that this start as irritation and discomfort on the eye. After that, it will start to be pain in the eye, redness of the eye. Then it will start to you will start to have
headaches.
Then
you're describing me
pain,
right now.
neck pain and shoulder pain, shoulder discomfort. You will end the day by you are not comfortable. You just want to go and sleep.
Close your eye. The crazy thing is that you want to sleep, but you want everything to be dark.
Yes,
because that's the only way you get the comfort.
Because the eye had so much light during the day from the computer and the mobile phone, and you just want to relax your eye. So in this situation, to prevent this situation, maybe there's a 20-20-20 rules.
Okay, what's
this
that?
Rule, when you use the phone or the computer for 20 minutes, you have to take 20 seconds looking at something more than 20 feet far.
Okay, no, doctor, we have to go over that. There's a lot that I want us to go over, but I want us to pause here. So 20-20-20 rule.
Yes.
To help your eye.
Yeah.
And the first is that if you look on your phone or computer for like 20 minutes, you must look away, look at something at 20 feet length, sort of, right?
Yeah.
And then
for 20 seconds.
For 20 seconds.
And try to blink 20 times.
Okay, so this is how it is. I'm going to do it. So 20 minutes. 20 feet for like 20 seconds, but in that period I should be able to blink like 20 times. I don't know how I'm doing, but I think I'm doing okay.
Yeah, that's very okay.
But that would help the eye.
It will relax the eye. It will relax the eye a lot. Because when you are looking at something near, there's a small muscle inside the eye will contract. It's like any muscle in the body. If you hold something for a long time, you will for 5 minutes it's okay. After that, you will start to feel the pain in that muscle. In the eye, this pain in the muscle, you will not feel just the muscle. You will feel the pain in the eye. Then if you continue using the computer or the phone, it will become a headache or neck problem.
So this is literally like a lifestyle disease that is causing the eye. So what's the implications of that? Continuous use, if I use it for more than 20 minutes. Look, I'm not gonna lie, I was watching the Tennis Paradise, tennis tournament, and because of Ghana and US time, you know, it's on around 1 a.m. 2 a.m. I'm on, and I'm sleeping on the bed with my husband, and I don't want him to disturb him, so I'm like this on the bed with my phone. So the phone is facing me, so I block the lights from him, and I'm on to like maybe 5 a.m. and I'm literally hardly getting sleep.
That's also
terrible.
Very terrible, because
I'm so terrible.
Now there's a lot of advices that we have to stop using the phone 2 hours before we go to bed.
Oh, This show is really about me, to be very honest.
I know if we tell anybody here that you have to stop your phone 2 hours before you sleep, no one will do it. But at least we have to take 1 hour that we are preparing ourselves to sleep. Don't use the phone. The blue light will make your sleep not comfortable. The eye will not be comfortable. Even your neurological system has to relax before sleeping.
Wow. So you don't use your phone 2 hours before you sleep. Keep your phone away. They are talking to me and talking to you as well, who's addicted to your phones, and 2 hours. And I want us to go back to the people who come to the clinic, who don't know that they have glaucoma. Yeah. They just walked in for regular checkup, and then you find out. Now you're saying that if 10 patients are there, 4 are likely. I mean, that's scary, because in Ghana, people hardly go to clinic just to check. They go when they have trouble. That's why I was thinking, okay, it's possible that the stats could go up, even though we don't have the data to back it. So it's possible that even there are more people who have it, except that we don't know.
Yes.
So what happens then when somebody comes in and then you find out that, look, you actually have glaucoma? What happens? That person, his family, what happens?
When the patient comes inside the clinic and we check the nerve.
Is it the Agrawal Hospital?
Agrawal's eye hospitals.
Okay.
When the patient comes to the clinic, we check the nerve, the optic nerve. We see some change in the optic nerve. Okay. This change may be physiological, maybe because of glaucoma, maybe other kind of diseases. Sure. So when we suspect glaucoma, we order for some scans after we check the eye pressure. I told you that even with the normal eye pressure, the patient still suspect of glaucoma. Okay. So we send him to do a scan to get the number of the nerve fiber inside the retina. There's a nerve fiber layer in the retina.
That's the one here, right? Behind.
It's behind the eye. It's
right?
Covering the eye from inside.
I'm not bad.
Yeah, you're so good. So when we count the number of nerve fiber, also the machine can count all the nerve fiber and compare the situation of this patient with the people at his age and from the same race, so we can find if he is glaucoma or not. Then there's another test called visual field test.
Visual
field test.
Visual field. Okay.
Yeah. That's to see if the patient can see, because when we are using one eye, we can see 120 degree.
Oh, wow.
Yeah.
Oh, is that why you make us do this?
Yes.
Oh, okay.
So
you got it.
that machine can test all the part of the visual field. So if there's any small defect, because I told you the glaucoma starts from the periphery toward the center. So we find if there's change in the periphery connected with the number of nerve fiber, we start medication for glaucoma.
Then, now you know that the patient may have or has. What do you then proceed to ask them maybe to bring their family? Because you mentioned that it's genetics. Yeah. So it means that if you have it, it's likely that somebody in your home, especially when they're over 42.
Yeah, mostly in the clinic. I always, when someone brings his father or his mother and check, and I find that we suspect or we find that the parents has glaucoma, I will force him to sit down and check the nerve. So, and I will advise for all the family member to come and check for glaucoma, because mainly the first cause of glaucoma is genetics. So it will be in the family. It's not for sure all the family member will have it, but they are highly suspected of having glaucoma.
And if you check and they don't have, does that mean they should never check, or how often should they?
Yeah,
once one person has?
That's why we advise yearly checkup of the eye. Okay. Yeah, once a year.
Okay.
Also for the cataract problem, it's mainly the age as we talk. So we just tell the patient that you don't have to fear about cataract, but we have to fear about glaucoma. Also in the population, the cataract, I told you, when the patient has cataract, he will come to the clinic. But when he has glaucoma, maybe he will not come until it's very advanced and we can do nothing at that time.
All right. So this country is a country of religious fanatics. I mean, yes, people love their religion and superstition. They're suspicious of everything. Now, I know you are in the medical field. You believe in science. Do you have persons coming with eye problem that you have diagnosed and they attribute that to spirituality or witchcraft, or that? Have you had that?
Actually, we have something worse than that.
Okay.
Some eye problems because of herbs,
okay,
because of some traditional treatment. Sometimes traditional treatment is good. Our mothers know the best. So when they advise us to just go away from the phones and just relax the eye, that's very good. But when they apply some eye drop for the treatment of cataract, there's no eye drop for cataract. Okay. There's no eye drop to just cure glaucoma, so that you use it once and that it is. The treatment of cataract is the surgery. The treatment of the glaucoma is the continuous of the eye drops. So a lot of patients come and they just have some corneal problem, some eye problem, just because they use some medication from, I don't know from where they get it, but it will be harmful for the eye. Other patients will come and they will refuse treatment for glaucoma because someone told them that this treatment will lead them to blind. Other patients will just think that it's because of some magic, or you call it juju, or
juju, yes.
Someone do something for them, so they have the glaucoma or they have the blindness.
Oh, they think that somebody had cursed them for something.
Yes, and it's very difficult to just make them calm down and take the medication, and that it is. Also, when you give them the medication, they will not continue with it. Yeah, they will use it for once and they will stop it if they use it.
And do they? How do you track such patients? I mean, I know it's not your job, but once somebody comes in,
one of our responsibilities. But because you know the tradition is very, very difficult, so we have to discuss a lot. We have in our clinic, we have some people are just for talking with this patient.
Oh, that's fantastic!
The counselor,
I like that.
We have some counselors just to talk with because they will understand better than us that how we have to deal with this patient. Even for surgeries or for any procedure we are going to do.
So they are like counselors?
Yeah.
Oh, wow.
We have some counselors just to explain for the patient in their language, in their very simple example about the condition, every condition and every problem they will face.
Dr. Tarboush, I would want you to just hold on a bit for me. We're going to take a break. We're taking a break. I am absolutely engrossed in this conversation, and I'm even more amazed that at Grawal's hospital, they have counselors. You know, you don't get that every time, not in every hospital that you go to. That if you go there with a religious belief or traditional beliefs, even though your problem is scientific or your eye problem has a solution, you have to be convinced as to why you should take that medication. And at Agrawal Hospital, they have counselors to convince you that, look, whatever is wrong with your eye is not spiritual, it's not magic, it's not juju, but if you take XYZ medication, it could be reversed. Like in the case of cataract, is reversible blindness, but glaucoma, not. So maybe they will have to do surgery, but you have to take the medication. That, I think, is what excites me about the hospital. But we're taking a break. When we come back, I want to find out from Doctor more about the lights that we have in our homes. And the vehicles are fixing these LED lights, like so high, so bright that it blinds you. What's the impact of that? After the break, we'll talk to him about that and more. We'll be right back. Welcome back to One on One. Today, I'm talking about a subject that I love so much, and that's about the eye, because I am telling you what, I am a victim of everything that's happened. I mean, self-inflicted, really. Says, doctor, if I have not picked anything from the conversation, is that when people go to the hospital just for general checkup, 4 out of 10 could actually be suffering from glaucoma, and that's high. That if you do away with this phone 2 hours before you sleep, you could be saving your own life. The light from your phone, your computer, is contributing to the trauma, the pressure on your eye, which could lead to, other diseases in the not so long future. So those are things that, but before the break, we were talking about, persons who go to hospital, they have all these beliefs, and because of that, they refuse to take medication, or they take it once and do not continue. And so at Agawal's hospital, they have counselors who will talk to these patients, encourage them at the very least just to use it. If it doesn't work, then you can hold us accountable or responsible. And for me, I really, really love that about the Agawal's hospital. But anytime I hear about surgery, eye surgery, I'm thinking that, are they going to just split the eye open? Are they going to replace the eyeballs? Is it bloody? Just walk me through the various types of surgeries that you do, and if it's bloody, and if it's painful. Yeah.
Actually, the eye surgeries developed very fast all around the world.
Okay.
Here in Ghana, in Agrawal, we use the new technique of cataract surgery that's called phaco.
Okay. Phaco.
Phacoemulsification. People like to call it laser surgery.
Okay, laser.
It's not laser; it's ultrasound, but. We don't use we don't cut or suture the eye.
Okay.
We just do a very small opening. We go with our machine, take out the cataract, then implant a foldable foldable lens. It will be spread inside the eye and take the place inside the eye. We put the lens inside the eye, then we go out with the machine and just without suturing, we just hydrate the wound, and that it is. This technique is the most developed technique all around the world. The vision after it will be restored from the next day, or after 2 or 3 hours from the surgery. The patient will start to feel the improvement. After 1 week, the eye will be healed. The inflammation inside the eye will be down, and the patient can take the glasses for reading if he did the monofocal lens. There's a different kind of lens that we can implant inside the eye. We have the monofocal, that's just for the far vision, single vision. We have the multifocal that will decrease the need for reading glasses also, and far vision will be okay, and the middle vision will be also okay. The glaucoma surgery, also we go to the glaucoma surgery if we find that the eye drop is not enough.
Okay.
We give the patient 2 or 3 kind of eye drops, and still the pressure high. So we think about the glaucoma surgery. We have different kind of glaucoma surgeries. We can implant a machine or a tube that will take the fluid from inside the eye and make the drainage of the fluid more easy. There's another surgery. We do small wounds to just make the eye relax and the fluid come from inside the eye to the blood directly. The pain during the surgery is very, very less, or the patient will not feel any problem.
Oh.
We do the local anesthesia.
Okay.
In some patients that we find that they are more not comfortable to do the local, or they don't want to feel anything, we can go to the general anesthesia, but mainly we do the local anesthesia with just an eye drop to the eye to stop all the pain. And during the surgery, we keep talking with the patient if they have any problem or any.
Also, they are active.
Okay. We can give them more painkiller, so they will not feel anything during the surgery.
So I want to go over just a quick one that after the surgery, patients can go. You said within 2 to 3 hours. Is that it?
Yes.
They'll be able to see again or get back to their normal self if they are wearing glasses. Is that
Yes, yes. They will be discharged from the hospital after 30 minutes.
Okay, and in glaucoma, if the eye drop is not working, then you can do the surgery.
Yes.
So local anesthesia, I mean, if you're listening, it's just you don't need to be put to sleep or anything. You are awake while they are doing it. If you need any more, whether painkiller or whatever, for them to apply, so you don't feel anything, they will do that. So it's literally painless or pain-free.
Yes.
So there is no need to be scared. Trust me, it's better to go through surgery, right, than to avoid it and then go blind. Everyone wants to see with their two eyes. I'm telling you, when my headaches come, I just wish that I could just throw it out. I mean, just about last week, I was admitted at the hospital because of my eye. Yeah, because I was having blurred vision.
Just blurred vision?
I was blurred. I couldn't drive. I couldn't see anything. And then the headache comes with a headache. Mine comes with a headache. It's crazy. But I think maybe this is what's causing it. I sleep with it.
maybe the phone,
and I know I'm not the only one. I'm admitting this on air because I'm sure there are lots of people who are like me, who sleep with their phones. Their phone rings and then you're up. Your whole sleep pattern is distorted, and we are the ones contributing to our eye problem.
Far from the eye problems, the sleep problem now is very common. The main cause is the digital world, or the phones and the computers, and we are always alarmed.
Okay, we talk about illuminate or how lights is good. I mean, there should be light, and you should see. At the same time, they say more light could also cause problems. Is that it? So explain to me, how much light then should one be exposed to at home? What light are we supposed to use that is good for our eye or not good for our eye? I want to know that.
This is a very complicated problem because it's personal. Some people will like the yellow light, some people the white light. But in general, the very high light, the bright light, is damaging the eye and even the psychological...
so the dim light is better?
Not the dim light, the middle light.
Not too loud, not too dark.
Depending on what you are doing. If you are relaxing, you don't want... Bedroom, dim is better. Okay. But if you are reading or you are doing something, good lighting is required. But the very high lighting will cause the eye irritation and headache and a lot of other things. I want to talk about the sunlight. Because there's some problem we call pterygium. Or pterygium.
Pterygium.
Yeah. Okay. This is a growth in the surface of the eye mainly because UV light, because of the sunlight. So it came with mostly with workers under the sun. They will have this pterygium, this growth that come from side of the eye to cover the cornea. When they will just feel some irritation. When it's inflamed, it will be red eye. Talking about red eye, we have different cause of the red eye. The red eye is a topic, a very long topic alone. So mainly it's infection or inflammation in the surface of the eye. Irritation, dryness, all these things can cause the red eye. But the pterygium also, we do a lot of pterygium removal surgery. Okay. We do some technique with the grafting just to prevent the recurrence or to decrease the recurrence rate. But pterygium is very also common in Ghana because of the sun. The sun here is very strong. The UV light is very high. So under the sun, mainly we need to use the sunglasses to prevent this problem, because when we have pterygium, the sunglasses will not recover it, but it will decrease the damaging because or the development of pterygium or bencosil. Other thing, the high cholesterol in the blood.
High cholesterol
in the blood. We can. This is a topic about the systemic disease connected to the eye. Under the age of 40, when we look to someone eye, we can see some a white circle or blue circle or yellow circle. This is mainly because of high blood cholesterol. So we suspect high blood cholesterol and we ask for blood test for cholesterol. With age, maybe it's normal, sometimes it's normal, but also suspicion of high cholesterol. And high cholesterol is a big problem.
Okay.
We don't hear about it
a lot,
to me, but high cholesterol mean that your blood has contain a lot of cholesterol that will go to the vessels, the blood vessels. So the high cholesterol can go to the blood vessels and cause the blood vessels to be more hard. So that will increase the blood pressure, prepare for some strokes and some other cardiac
I'm
and
so glad you mentioned that.
Blood
so
vessels problems. Yeah.
Oh. Yeah. So, because I had a question in my head whether there's a link between the eye, the brain, and stroke.
Yes.
And then transient intrinsic attack. I had that, you know. Where
sorry.
they say, I had that, and it's scary because like you're almost getting stroke, you know, and it's scary. Yes. So just walk with us through the link between the, you know, your eye, the brain, and how that triggers stroke.
Okay.
Yeah.
I will just link it with as we talked before, that there's irreversible lose of vision and reversible lose of vision. Some of
reversible is cataract, irreversible is glaucoma.
Okay. There's another cause of irreversible lose of vision because of blood problem.
Okay.
Like we call it central retinal artery occlusion.
Central retinal artery
occlusion. Yeah. The block of the central vessels that give the retina the blood. So when that vessel is blocked, that means the blood will not go to the retina, and the retina will start to die.
Ooh.
What caused that is a stroke.
Ooh, wow.
So the stroke that happen on the eye, it may, if we don't treat the whole body, the cholesterol, the blood pressure, the blood clots, or if there's any problem in the blood itself, it will cause stroke in the future. So,
but does that come from one? So lifestyle, what you eat is part of it, or inactivity? What is it?
It's high cholesterol because of sometimes the kind of food, kind of diet, and low exercise or.
I'm a victim of that. Okay, Doc. So earlier, Doctor, you know, you talk about there's a rapper in Ghana. I'm not even mentioning him. You know it already. So they wear their glasses indoors like this all the time, you know, when they are doing interviews. So I'm doing an interview. I'm wearing glasses. Is that okay? Is that safe?
That's will not hurt the eye, but that will make the vision not clear. That's the main problem.
So that will give pressure to the eye to them.
The problem that when we have low light, the pupil inside the eye will be dilated to let more light come inside.
Oh, okay.
So if we have this kind of glasses, it's not protection. There's no protection against UV light or against blue light.
Sure.
So when you put it and you are using the computer, or you are in a little bit high light environment, that will cause some headache because of more light entering the eye. More UV light.
So it should be worn outside in the sun.
Yes.
That's where you get the full benefits.
Yes. It's very protective under the sun, but it will not protect you inside. It may cause some headache or some discomfort after a while.
Okay. Doc, I know you've been in Ghana for like over 5 years now.
Yes.
Right? Why Ghana though? Why Ghana?
Actually, I went to Ethiopia before.
Right.
I went to Dubai. I went to some countries. But when I came to Ghana, I found more peace here. I like the situation here. Right. So 5 years, and I'm thinking about.
But what about general knowledge of persons on their eye? Was that also a factor where?
Yes, that's another thing that here I found myself more active.
Okay.
People need the services and need more eye doctors in this country.
Oh, wow. Okay, Doctor, we're wrapping up. I just want to say that a very big thank you to you, first of all, for coming.
So
I am grateful that you came. I hope I was able to mention the hospital. I'll try one last time. Agawal, Dr. Agawal's Eye Clinic. Agawal's yes. Eye Clinic and Eye Hospital. Dr. Nashat Tarboush. Don't worry, I'll get it. Dr. Nashat Tarboush. Next time I'll say so. Ophthalmologist, and he's been here for over 5 years. Says he loves the country. Oh, before we go, when are you doing free eye screening? Because I want to be there.
That's what I'm telling you. Yeah, you are welcome all the time. Yeah. But we have like free time that we do in the week of glaucoma. We have free screening okay. and free testing. Also. We planned and we are planning for more screening tests outdoors, outreach, and we hope that we can reach the very far area inside Ghana, because in the cities it's less problematic than inside in the far village or the country.
And because of access, resources, and also they could have even more issues.
Yes, they have more issues, but we are planning, and because we just planning and we don't know the cause that why we didn't go there before, but we are trying to do it.
Dr. Nashat Tarboush. Yes, I got that. Yes, yeah, finally. Dr. Nashat Tarboush, thank you so much for coming to our studio. It's been an eye-opening session for me. Literally eye-opening session for me, and also for me the tiny tips that you've given us is very important, that could help us, reduce the pressure on our eyes. I'm making a promise to myself, I'm not sleeping with this phone again. I hope you can also do the same at home. Just basic things, check your cholesterol. And if you are lost, you have nowhere to go, you just go to Dr. Nashat Tarboush at Agawal's Eye Hospital. And ask her, who knows, you might just get the free eye consultation. I'm going to get one. And I want to, So thank you at home for watching. I hope that you've also learned a lot. And one last thing, What about the lights? When you're driving and people are putting the thing in your eye, it's so blinding.
Yes. Also, it's you mentioned that it's some sign of cataract also at night, especially at night when you see circles around the light or the blurred vision around the light. That's one sign of the cataract. Also, I want to mention last thing about the glaucoma, that sometimes people come with just they see some shadows around the light or rainbow colors around the light. That's one sign of high eye pressure. Okay. So whenever you have this, you have to check up the eye for glaucoma.
No, I think there's a part of my brain that says, I asked that question because I wanted to be able to mention your name again, that Dr. Nashat Tarboush. He's an ophthalmologist with the Agawal's Eye Hospital, and he was my guest on the show, and I have absolutely enjoyed it. It was interactive, it's basic, so you understand it. You don't need to be a scientist or medical person to understand. Like everyday Ghanaian can understand this, and I appreciate it, and I hope that you value your eye, and if you're in any trouble, just find them and go to them. My name is Bridget Otu. Thank you so much for watching.